Hello, today we're gonna perform a breast implant surgery. The patient is coming from UK. She is 43 years old. We planned our pocket under the muscle. We'll take care about to perform a nice décolleté to her. Mostly we will work on the inner and upper part of the breast. So the patient is coming in a few minutes. So the incision will be done just 1 centimeter below the inframammary fold. We will fix also drains. After the surgery, we'll be showing you the result, and she will take her room. This night she will stay in hospital, and tomorrow we'll make a visit, and then we'll see her. Then we'll send her country back after 1 week.